Hello viewers and welcome. My name is Betty Mwaura and today we are going to look into over-the-counter medicine. Maybe to make a brief description, these are medicines that you can be able to buy from the pharmacy without a doctor's prescription, and these are medicines that are safe for use for general population. For this medicine, once you go to the pharmacist is also allowed to sell to you without a prescription. And these are medicines that are for maybe for simple medical conditions, maybe a painkiller for headache, stomachache, something like for diarrhea, antacid, some simple medicine that that can be able to sort you out before maybe you seek the doctor's advice if the symptoms persist. There are those that are called medicines usually have a positive effect on your body. We also have drugs. Drug comprises of both medicine and maybe those that have positive effects on your body and those that have negative effects on your body. Medicine, therefore, they have positive effects on your body, and they are going to relieve your symptoms, and they are also going to treat your disease. But maybe if we include drugs will cover both medicines that have a positive effect and drugs that usually have a negative effect. And these drugs could be maybe something like cat or mira, or maybe those drugs that are usually used, maybe they're not necessary for the body, but people use them. Those are the drugs that you are saying that they would cause negative effects on your body, and it's not that you would need them. For the over-the-counter medicines, they are safe for use in general population, and you will not require to have a doctor's prescription for these medicines to be given to you. Then there are also some population that would need maybe to seek a doctor's advice before you go and buy over-the-counter medication, especially for expectant mothers. Also, maybe those who have underlying conditions or maybe long-term diseases. You're not advised to go to the pharmacy and just buy drugs over the counter. And even maybe children who are below 2 years, it's always good to seek medical advice instead of buying medicine for the children who are less than 2 years. And even you take precaution also when you're buying medicine for children who are below 5 years. But when you go to the pharmacy, those who are working in the pharmacy, they are also equipped with the knowledge to know what medicine to give at a particular time. But for those people that I have mentioned, and even the old people, people need to be cautious when they are purchasing drugs over the counter. There are also those people maybe who are asthmatic, and there are also drugs maybe that are also not they are over-the-counter medications, but they can also have a negative effect on them, like a simple medicine like Brufen that you can get over the counter. It is not recommended for those people who are asthmatic because it can precipitate asthmatic effects. And also maybe those people who are hypertensive, they usually take aspirin. Aspirin, we know that it's a drug that is used to thin blood. But if you go to the pharmacy and you get an over-the-counter medicine that still has aspirin, it can also have negative effects because it may increase bleeding in the body. So you have to take precaution when you're buying medicine over the counter, especially for that population that I have mentioned. So some of the things that you need to put into consideration when you're taking your medicine is the route of administration, like how have you been told to take your medicine? If you have been told to swallow, if you have been told to apply, if you have been told to maybe insert, you have to follow the instructions so that the medicine works for you. You are also not supposed to exceed the recommended dosage that you have been given because of the side effect that you can get if you take an overdose of medication. You're also supposed to do you can also maybe refer to the medicine labels. They usually have labels or insert. It gives you more information on the medicine. You can also read it for yourself. If unsure about any medication, always consult a health professional. And also, it's also good to mention if you're on other medication. If you're buying over-the-counter medicine, Also remember, if you have any other medication that you're taking, you also need to mention, because sometimes you can also take medicine that would cause interaction with what you have. And if you're also expectant, if you're an expectant mother, most of the medicines, they are usually contraindicated, and even when you're breastfeeding. And when you're expectant, this is a very sensitive period, because some of the medicines can even cause deformities to the unborn baby. So if you're expectant, you're also advised to always say that you're expectant, so that you are given medicine that is safe for pregnancy. You also, or even when you're also breastfeeding, there are also medicines that are not recommended when you're breastfeeding, because maybe they will pass through the breast milk to the baby. So when you're also breastfeeding, always mention that you're breastfeeding when you're purchasing drugs, so that the person who is selling would know what is to be given to you. I've also said about those people who are on long-term medications, like people who are taking blood pressure medicine or diabetes medicine. And also, I would also encourage these people to always get their medicine from the doctor who is seeing them. For these people, I would encourage you to be seeing your doctor, so that they can recommend what you're going to take. Because maybe you have other medications you're taking. Most of the time, there is what would be safe for you. There's what will not interact with the medicines that you're taking. So it is always advisable for these people to see the doctor if they are not feeling well. And also other people who have other long-term maybe medications that they are taking. It's always good to see your doctor or your physician for a prescription in case you have maybe any issue that you need to purchase medicines for. Also, I would advise for those people who are on, maybe those who are on pressure medicine, those who are on diabetes medicine, don't take your medicines like for 1 year without seeing the doctor. You're usually advised to go back and see the doctor, because they will keep track of maybe how your medicine is doing. The doctor may need either to adjust your dosage, maybe at least give yourself after every 3 months, just see the doctor, so that the doctor can be able maybe to do some investigations and also know whether, if it's your pressure, whether it is stabilizing. Are you doing well? Is the medicine that the doctor has given you working? If maybe, and even for the blood sugar, the doctor would be able to tell you whether what you're taking is effective for the condition that they are treating, and also maybe to advise if they would need to adjust the medicine, they can adjust, or even if they need to give you more advice on what you're taking, you will be advised better. Instead of maybe taking your medicine for the whole year, maybe for your sugars, they have dropped. You may not need maybe a combination of the medicines that you're taking. The doctor may need to knock off or maybe a medicine, because now your sugars or your blood pressure is stabilizing. So that is an advice that I would give to those people who are on long-term medications. So what are some of the benefits for the over-the-counter medicines? Some of the benefits for over-the-counter medicines are they are easy and quick to access, like you will need to consult to get them. They are also available in the pharmacies around. You have so many pharmacies around. They also lower the health cost. We know that maybe to get health attention from the doctor, it usually takes maybe you may need to get money so that you can be able to see the doctor. But if you're going direct to the pharmacy, you just need to go without consultation and ask for the medicine that you need. It also enables maybe the patient to select from the variety of the medicines that are available. That if you think this painkiller works better for you than any other painkiller. And also maybe it's also good when you're doing this to see, to listen to the advice that you're being given by the person who is selling this medicine to you. Because maybe if you think that there's this painkiller that you need over the other, could be maybe there's one painkiller that does not cater for inflammation and you have inflammation, and you can be advised, if you take this other one, it will cover for the inflammation, it will also cover for the pain. It's also good maybe to listen to someone who is selling this medicine to you, because they also have the knowledge on what could be good for the condition that you have. And remember that you're not supposed also to take the over-the-counter medicines for a long time for the same symptoms that you're feeling, because it could be you're also masking an underlying condition that you don't know of. So don't take over-the-counter medicine for a long time if you're treating the same symptoms, because maybe it could be something that has not yet been diagnosed. So you need to seek medical advice. Like you need to go and see the doctor and explain to the doctor that I've been taking maybe painkillers for these and these symptoms. They don't seem to go away, or they go away for some time and then they come back. So you need to go and see the doctor so that the doctor can do more investigations, and maybe this will also maybe lead maybe to the doctor being able to treat the cause of your symptoms, so that you're not every time you're not going to the pharmacy to buy those painkillers. They relieve you for some time and then maybe your symptoms are back. There are some medications also when you're taking them, you would also need to consider that they may cause some side effects, like the common diclofenac that we usually take. There are those people who have ulcers, and some of these medications may cause bleeding. So, like something like diclofenac, there are those medicines that are safe when you take over the counter, and there are those that will not be safe, especially for those people with ulcers. Maybe something like diclofenac, it also increases the gastric effects. Like you may feel a lot of pain. It can also cause bleeding, and these are some of the things that you also need to be advised on. And you also need to know that maybe when you have such conditions, when you're going to buy medicine over the counter, if it's a painkiller, there's what would be more suitable for you. There's what is not recommended when you have maybe the ulcers. All the medicines have the capacity, or they can cause side effects. Even the simplest medicine like Panadol, if taken in excess, they can cause even something like liver toxicity. So you are supposed to take your medicine at the correct dosage that you have been given. This is how you moderate the side effects of any drug, so that they don't give you a severe side effect. Whatever it is that you're getting, you have to take the right dosage, maybe because it will minimize the side effects. But any medicine has a potential of side effects. There's no medicine that would not have any side effects. There are also drugs maybe that are usually controlled by the government because of the effect that they would have. Maybe something like codeine. There are medicines like beta pain that most of the people usually buy over the counter, but these are medicines that are usually controlled because they have a drug that can cause dependency, and they also have side effects that maybe causes people to usually go for them most of the times. So these are controlled medicine, and maybe even if they can be sold over the counter, it's not that they are supposed to be sold over the counter. Something else that I would need to mention on are the antibiotics that people usually buy over the counter. Antibiotics are not medicine that are supposed to be sold over the counter because of resistance. And then again, for you to get an antibiotic, if the doctor needs to confirm that you have a bacterial infection so that you can get that antibiotic, because most of the times usually you go to a pharmacy or a chemist and then you have the symptoms. Maybe you have the fever, you have the flu symptoms, and you ask for an antibiotic. Most of these symptoms, they're usually viral. And viral infections, they can even resolve themselves. You can either treat them, you can treat viral infection symptomatically, or it can still resolve by itself. But if you are taking an antibiotic, you need to confirm that you have a bacterial infection, because if you take an antibiotic and you don't need an antibiotic, what it does, it causes resistance to your body. So that maybe next time, if you're given the same medication, it may not work because you have abused that medicine. You have used it in your body when it did not need to be used in your body. And even maybe to mention something about maybe antibiotics, if you are given an antibiotic and you're told to take for 5 or 7 days or maybe 3 days, then you don't even finish your antibiotic course. It also causes a resistance because you have not treated the bacteria that was to be eliminated, and you will cause resistance to this medication, so that maybe the next time the doctor needs to give you the antibiotic, the doctor may need either to use to change the antibiotic completely, because maybe whatever you got previously, it cannot maybe treat you anymore because of the resistance. So it's also good to know that when you have been given an antibiotic, you're supposed to complete it for those days that you've been given. There is an antibiotic for 3 days, there's an antibiotic for 5 days, for 7 days or 10 days or 14 days, whichever time the doctor has given you an antibiotic for, you have to finish your course of antibiotics. What are the difference between the over-the-counter drugs and the prescription-only medicines? The only difference is that for prescription medicine, you're not supposed to go to the pharmacy and ask for that medicine because of the maybe the harm it can cause to you. It is the doctor who is supposed to give you that prescription for you to go and ask for that prescription-only medicine in the pharmacy. But we have said that for over-the-counter medicines, they're usually safe. You can use them even without the doctor's advice. So, the medications that you need to get a prescription from, they're usually not allowed to be sold over the counter because maybe of the effect that it will have in your body. That is why you're not allowed to go and buy them over the counter. What are some of the dangers of self-medication? Self-medication is what we have said, that you go to the pharmacy and ask for medicine. Sometimes you may do an inaccurate diagnosis, like whatever symptoms you have, it could be what you're treating is totally different with what you're suffering. So this is what we are calling delayed diagnosis. That means that maybe there's something that is in your body that you have not captured. A disease that is in your body that you have not been able to capture, but you just go to the pharmacy with the symptoms and you get that medicine. That is how you delay your diagnosis, because you're not actually treating the actual problem that you have. You are only dealing with the symptoms. Also, maybe drug addiction. I said there are those drugs that are usually controlled, like those that have something like codeine. They usually cause addiction. And even cough syrups that have these components like codeine, they usually cause addiction. Like when you take them, they usually, that's good feeling that you have. And this is what would cause maybe you to want to be going back for this drug or this medicine. So sometimes this can cause addiction. That every other time you want to go for this medicine because it makes you feel good, and this is not good, because eventually if you're addicted to something, it will still have negative effects on your body. We also see maybe adverse drug reactions or allergies. You may take something that will you react with, and these are the adverse drug reactions that like the allergies that you can get. And also increased drug resistance, maybe with the antibiotics. Every time you go to the pharmacy, you have maybe a cold or a flu and you want to get an antibiotic, and this eventually can cause maybe disability, or maybe and even premature deaths. You don't know, because maybe you take so much time before you get your diagnosis, and maybe it's something serious that was developing in your body, and eventually it can become very bad at the end. And also maybe drug interaction, dangerous drug interactions, because if you have other drugs that you're taking, then you go to the pharmacy, you don't even say that you have other drugs you're taking, and then maybe these drugs, when you go and take them, they cause drug interactions that are not good. Also the incorrect manner of drug administration. E.g., maybe you have been given some drugs, maybe some two drugs that are not supposed to go together. Like there are sometimes you can be advised you're supposed to take this medicine first and then you continue with this other one, because maybe of the either interaction, or maybe one of the drugs can mask maybe an infection that needs to be targeted by the other. These are some of the things maybe that can cause this incorrect manner of administration of drugs. And also maybe if you're a wrong route, you have been told to maybe insert a suppository, and then again you go and swallow. These are wrong routes of administration. And also the timing. You have been told to take a medicine twice a day, and you do a morning, and twice a day actually means it's twice in 24 hours, so it's after every 12 hours. If you're told to take a medicine 2 times a day, it will be after every 12 hours that you do 1 tablet in the morning, 1 tablet in the evening after every 12 hours. If you do 1 tablet in the morning and 1 tablet in lunchtime, that is not twice a day. That is after 8 hours. If you have been given a medicine to take like 3 times a day, it is after every 8 hours. So 3 times you're told you do morning and lunch and evening. And this is usually after every 8 hours. That is 8-hourly medicine. If you're told to take maybe 4 times a day, that should be after every 6 hours. Like after every 6 hours, you get 4 times a day. That is how you're supposed to, that is how your timing for medicine should be. If you have been given a medicine to take once a day, it's supposed to be once a day after every 24 hours. So if you're doing that medicine maybe 8 in the morning, it should be 8 in the morning the following day, because that will be after every 24 hours. And that is how your timing for medicine should be. Why are you advised on what time to take your medicine? Sometimes you can be given medicine and you are advised to take it before meals. You have been told to take it before meals because sometimes when you take this medicine after meals, the food can interfere with the absorption of that medicine. So that is why you have been told to take it before meals. The medicine would be absorbed better if you take it on an empty stomach. At times, you're also told to take a medicine after meals. And most of these medicines, they usually cause stomach irritations. And also, there are also those medicines, when you take them after meals, the absorption would be increased. And also, if you take them after meals, some of them, they prevent maybe the side effects that you would get after taking the medication. That is why sometimes you are advised either to take before or after meals, depending on the type of medication that you're taking. There are also medicines that you can be told not to take with some types of food. Maybe you have been given a medicine and you've been told not to take it together with milk. It's because of maybe the interaction that the food would have with that medicine, such that when the medicine interacts with that with the food, it would cause reduced absorption. It can maybe cause some interaction that would make this medicine not to be absorbed into the system. That is why sometimes you can be told that you're not supposed to take this food with milk, or maybe with dairy product, or maybe whichever type of food that can cause interaction. That is why you usually advise not to take some medicine with some food that can cause interaction. Some of the safety tips for over-the-counter medications are: you are supposed to keep the original container with the label for medicine. Because maybe if you discard the original container, or maybe the box that has been labeled on how you're taking, you may forget on how you are taking the medicine. So you're supposed to take to keep that container, or maybe that box where the dosage is written, until you're through with that dosage, so that you avoid maybe confusion. Also, you're supposed to take the right dosage, meaning that if you have been given maybe to take 1 tablet 2 times a day, you don't do 1 a day, or you don't do 1 3 times a day. So you're supposed to take the right dosage. You're also not supposed to mix medicines. Maybe if you have 2 syrups and you have been given, maybe it's a baby who is taking a 5 ml of one medicine and a 5 ml of the other medicine, don't mix them together. Like you do 5 plus the other medicine, you do 5 again together, you mix them in the same container. You are not allowed to do that. Those are 2 different medications with different components, and you may not know how they are going to interact. Also, maybe if you're an adult who thinks that, or maybe who does not like swallowing medicine, and then you crush them, like you take like 2 or 3 medications, you crush them together, that is also not right. Because again, these are different medications with different active ingredients, and you may not know the interaction that they are going to have when you crush them together. So you're supposed to do one medicine at a time. You're also advised to store them properly. Medicine is supposed to be kept in a cool, dry place. Temperatures not to exceed the normal room temperature. And also maybe you remember about the fridge items. If you're supposed to keep a medicine in the fridge, it is supposed to be stored throughout in the fridge, because maybe if you remove them from the fridge, it will go bad. Like it's no longer good for use. So if it's a fridge item, make sure that it is kept in the fridge. If it is a normal drug, make sure that it is kept in normal room temperatures, not high temperatures. And you're also maybe advised not to keep them in the kitchen, because kitchen there is heat, so the temperatures can be too high. Just keep them in a cool, dry place. When you're taking over-the-counter medications and other herbal medications, don't take them together. Maybe there's something that is like you have herbal medications that you've been given for a certain condition, and then you are also taking these other medications. You're not supposed to take them together. If you're doing herbal medications, do herbal medications. If you're doing these other medications, do them separately at a time. Unless it is the doctor who advises you and tells you, even if you have this herbal medication, you can also take these other medicines. Or if you have these other medicines, it is also safe to include these other herbal medications. Otherwise, you're advised that you're not supposed to take them together. You do either at a time, or with the doctor's advice, the doctor would be able to know whether they'll be safe if you take them together. For over-the-counter medicines also, I would also want to mention that if you go to a hospital, the doctor may also give you over-the-counter medicine, depending on what you're suffering from or your symptoms. And this does not mean that the doctor is incompetent, or you say that this is what I usually get from the pharmacy. So, and I've come to the hospital and the doctor also gives me the same medicine. The doctor, after the diagnosis, they usually give you medicine according to maybe what they have diagnosed you with, and also the symptoms. And remember, a doctor also gives you the safest medicine for you to use at that particular time. The doctor would not go for maybe very complicated medicine, and there are simpler medicines that can be able to sort your case. So that's maybe next time when you're going to see the doctor, he will have an option. If you maybe this time you're given this painkiller, like paracetamol, it's usually the safest painkiller to use, even in the hospitals. If it did not work, now the doctor can have options of going to other painkillers. So don't say that now the doctor gave me Panadols and this is what I've been getting. Yeah, Panadol is in fact the safest medicine for pain. There are different types of pain, but maybe for the simple one, like the fever and maybe headaches, this is the simplest medicine, and it is very effective that the doctor can give you. So don't ever complain when you go to a hospital and you think that the doctor is incompetent because they are giving you something like Panadol to relieve your pain. I would like to mention the routes of drug administration. We have various routes for drug administration, and the major one is oral. Oral is you swallow your medicine. You swallow your medicine with water. There's also something called sublingual. That one you may be supposed to place the tablet maybe under your tongue and it dissolves. There are those tablets that can be dissolved orally and they are called sublingual. Other methods of administration, there's maybe intramuscular, maybe you inject in your muscle, intravenous, maybe that one it's through your veins. Subcutaneous, maybe those who do insulin, they are also supposed to inject under the skin. There's rectal, like for the suppositories, maybe those people who suffer from hemorrhoids, they're usually given tablets to insert per rectum. There's also maybe those ones that are usually given to insert in birth canal, maybe like the fungal or thrush for ladies. There are also maybe inhaled ones like for asthma. There is topical, maybe for the creams, and also others called transdermal or maybe the patches. These are some of the routes of administration that some of the routes for drug administration. I would also mention that the doctors have the knowledge. They treat because they have the knowledge, and the knowledge, it comes from God. So the doctors, they will always give you medicine because they have the knowledge, they have gone to school, they have learned, they know how to manage these diseases. But there's a God who gives them knowledge. So God is above all, and He is the healer of our diseases. So every time that you're going to seek medical attention, wherever we are, let us know that we have been treated and we have been given what could be best for whatever it is that you're suffering. But after all, there is a God in heaven who is our healer. And with that short preview of the over-the-counter medicine, I come to an end, and thank you so much.